First of all, I'd just like to provide acknowledgement of country, custodians of the country that we're all clicking in from. Of course, I'm here in Jagera Yugara country. I'll leave Shirley to introduce where she's coming from. I think she's in the NPA. Acknowledgement is an important part of everything we do, and hopefully it's not just at the beginning of sessions like this. One of the important things to acknowledge is also the cultural strengths of our First Nations people and the things that have happened since in the last 200-something years, which leads us to the situation where there are health inequities within our country. And yesterday was Close the Gap Day, so that's sort of an indication, acknowledge that through the things that have happened for the last couple of hundred years, things that have happened which has detrimentally affected our Aboriginal and Torres Strait Islander people. I'd like to acknowledge everyone that's on here clicking in, because I acknowledge your efforts to actually redress and right those wrongs and help close the gap as a result of that. Without further ado, I will welcome Shirley and we're looking forward to her presentation. I hope there'll be time at the end for questions, because I have a lot of them. So without further ado, I'd like to hand over to Shirley now. Thanks, everyone.
Thank you, Eric. So kapu batanga, good morning, seongapa, welcome everyone. My name is Shirley Kusu, and I'm a Credentialled Diabetes Educator, Clinical Nurse Consultant. First of all, for acknowledgement, I'd like to acknowledge the traditional owners, the Angamuti people of the land and waters from which I'm presenting today. I'd like to pay my respects to the elders past, present and emerging. So today, where do I start? When I, first of all, when I received an email from Eric saying that they wanted me to talk about myself, I'm not someone who likes to talk about themselves. And so I thought I thought about it, and I thought, okay, I'll do it. It's just as an encouragement for our people, for our listeners, those who are looking in today, and those who will be looking at watching the recorded session, and just to encourage all the young ones and people out there that are wanting to study and go into the health field. I mean, we're all doing this to help our people. I mean, raising our health status, closing the gap, as Eric mentioned yesterday, closing the gap day. We just need more of our people working in the health field, whether it's medicine, nursing, allied health, dietary, dietitian, dentistry or social work. So here it goes, my story. So I'm a Torres Strait Islander, an Aipkadal woman. Originally, my family's from Saibai Island, the northernmost island of the Torres Straits. And I come from, my father's clan is the Aipkadal clan, and my mother was from the Soibaidam clan of Saibai Island. I was born and raised on Thursday Island, locally known as TI. Went to school in TI, started my primary school in TI, and then off to Cairns for high school, years 8 to 10 in Cairns, and then returned back home to do my seniors, 11 and 12 finished here. And I'm a mother of 3, but I also raised 7 of my siblings' children and a grandmother of 19. The picture you can see on the slide are 2 of my children, 2 youngest ones. and one of my grandsons there. And the flag I've got up there is the flag of the island in which I come originally from, Saibai Island. So my education and training, like I said, I started off in Thursday Island, went off to Cairns, came back, and then I did my associate degree in Aboriginal Health at the Curtin University in Perth. And then went on to Bachelor of Nursing. Now, took me, 5 years, 6 years to do my nursing, just juggling. Some people might, as you know, like when we've got a family, we're juggling nursing or studying, and working, raising children. And also I was looking after my mum as I was studying. So, but she was my greatest, I suppose, admirer. So she pushed me along and made me where I am today, I suppose. Even though she's not with us anymore, but it was her that always told me to keep going. And even though I was juggling and life got in the way, kept doing what I had to do. Then finally did my grad cert in 2015, 2016 through JCU as well. So like I said, a lot of challenges and enablers also. My mother was my biggest enabler, support, strong, independent woman, and made me who I am. Like I suppose shaped me, my determination and perseverance of juggling work, life, and study. It wasn't easy. And if you read the synopsis where just looking at my challenges there, back in 2010, I was also diagnosed with type 1 diabetes. So that kind of also shaped my career, my thoughts on going down the path of diabetes education, wanting to know more information about how to manage myself, and living at the time in Thursday Island, remote area, not having all the health professionals that help in supporting people living with diabetes back then. So the diabetes educators and the credentialed diabetes educators, as well as the endocrinologist. We didn't have any endocrinology people visiting. We just had the GPs. And it was a struggle to also have that to deal with, along with everything else. So yeah, it was my journey, really. I wanted to know more for myself as well. And then I thought about, as I was in my early years of nursing, I thought, if I can't understand how to manage my diabetes, then how is anyone out there, another Torres Strait Islander, Aboriginal or Torres Strait Islander person with English being their second, third language, is going to understand a health professional trying to teach them or give them the skills to manage their diabetes? I mean, I thought, no, I need to do something about this. And as I was working in the Thursday Island Hospital emergency department, at that time, 60% of our admissions were all diabetes related, and as I got to know the patients, and they all said the same thing: we have no idea what the doctors and nurses are talking about. when they're telling us to do this and that to manage our diabetes. We don't even know why we're taking these tablets or the insulin, you know. So that kind of really channeled me into diabetes educators, a diabetes educators course. Yeah. So did I just go back? Sorry. Yeah. And then as I was studying 2015, 16, finished off, and then I wanted to do my credentialing. So I was in motor vehicle accident, which was another barrier and a challenge, trying to get into, to do the, apply for the credentialing. My first attempt was 2018, didn't have enough hours, so reapplied again in 2019 and got in and got my credentialing then, so has been working in that space since, on Thursday Island before moving over to where I am in Northern Peninsula Area now. And as I was, like I said, when I started diabetes, back in 2019, I worked with Eric through NDSS and did the Feltman Facilitators Training, as well as the SMARTS program. So delivering the SMARTS program as well as Feltman through education as I was working in diabetes education. So where I am today, working in the Northern Peninsula Area, I work with deadly team of health workers, primary healthcare nurses and doctors, midwives, and the allied team. They come over from Thursday Island. There's no one based here in NPA. And we also have the pleasure of the endocrinologists coming up 4 times a year from the Cairns Diabetes Centre. So I also work with them. And I service all 5 communities of NPA. So Bamaga, Sasia, Yamajiko, Indigenous, and New Mapun. And I look after people living with type 1 and type 2 diabetes, as well as gestational diabetes and women with diabetes in pregnancy. So all the women with type 1 and type 2 in pregnancy. Yep. So pros and cons of working as a diabetes educator. Now, so this is all based around where I am. So being remote, we don't have a full team. Well, I don't have a full team of dietitian on ground, that is, dietitians and social worker, exercise physiologist. It's just myself and an advanced health worker that works with me. So the pros of working, so working with my people, working on country, and I work with an excellent, supportive team, constantly learning, because I'm not originally from here. So when I first arrived here, I was always working with health workers that were from here. So getting to know how things work for the Aboriginal community here, the people, and just knowing how to, I suppose, how to engage with them, because I had no idea how to do that, even though, like, you know, people, all the non-Indigenous people, doctors and nurses, thinking that come here think that I can just come in and engage with anybody. But I had to tell them, like, that there is a difference. I'm just wary of how I engage with the Aboriginal community here on country. So another pros of working as a CD here is being the link between our people and the health service, help them to navigate the health service, I suppose. And also having the being at home, so having the work-life balance, which can go either way. Having the commitments, cultural obligations, as well as the work obligations. So trying to have that in balance. And I also like to see myself as the instigator to change, trying to bring change to our people, and of course doing it the right way, and sitting down with them and having helping them to manage their diabetes the best they can, their way, whatever is suitable for them, and as well as lifting the stigmas around diabetes in community. You know, when I first arrived here, I heard a lot of people say, oh, you know, I've got diabetes. And when I try to tell them that, you know, you don't need to be living, or you don't need to be thinking that, oh, I've got diabetes, I'm going to end up on the dialysis chair, or I'm going to end up with without eyesight, you know, stuff like that. That's all things that can be prevented. We don't have to. We can live a normal life with diabetes. And then I normally just share my story and say that I'm too living with it. I know the barriers. I know how hard it is, because I was diagnosed here in country, so I can be that support, so, and empathize with them, you know, and appreciate the challenges that they are too going through. The cons, working remotely, the workload, I suppose, and just trying to juggle work-life balance and limited resources, human and material. So not having a full team on hand, and difficulties in working with people that are non-engaging, just have had bad experiences with the health service, and just feeling that not sure whether to come to their appointments or not, and maybe and I suppose meeting them halfway and sitting down and talking to them, and maybe finding out from whether it's the building that I can always go out into the community and have a yarn with them at home, or just under a tree, you know, just about their condition. Yep. And also the cons, another bad side is just undermining. We still get some doctors coming through, and other health professionals maybe thinking that they're the doctors, so they should be the one having the last say. But yeah, that's slowly working to change all that. And I suppose this is just when they first come in, and they just look at you and think, okay, so you're just another health worker. So no, I'm not a health worker. I'm a Credentialled Diabetes Educator. I'm a registered nurse, and you know, breaking all the barriers there. But all in all, they're great people. They're just from mainstream and coming into a community. which they have probably no idea of what to expect. Yep. I was also asked to talk about or give tips of establishing culturally safe practices. So, like I said, I would continuously reflect on my own culture, attitudes, and my beliefs when I'm working with people of different ethnicity, like the Aboriginal people or any other ethnic group around the world that live and visit NPA. We have a lot of people come through during this tourist season from May to October, and dealing with them as they're coming or working with them when they access the service, and always providing a holistic health service, looking at other means of why the person's not taking their medications or not coming to the appointments, because they're having to deal with other problems like housing or financial problems or whatever it is that they're dealing with. Their priorities would be different to ours as health professionals, and we're always talking to other nurses and non-Indigenous nurses and doctors about that, and keeping an open mind always, and asking them to keep an open mind and be adaptable to the best of their ability through the advice that I offer to the non-Indigenous health professionals, and just being respectful of the diversity, and always building trust with the clients, working slowly with them and at their pace, and once that rapport is built, then all the barriers then go away with them accessing the health service. And all comes down to building that healthy relationship between the health service and the community. That's my aim, always. Yeah. So my tips or recommendation of becoming a CDE or a Credentialled Diabetes Educator. So I did my studies through JCU, part-time. They offer it full-time for 1 year, or part-time 2 years. We also, in the Torres and Cape Hospital and Health Service, they've offered, just last year, they started offering First Nation scholarships to any of the employees wanting to pursue a career in health. Sorry, not in health, in nursing or medicine. So for health workers or those that are in operational staffing. Yep. And there's also that Queensland Health Remote Incentive, the Study and Research Assistance Scheme, that is accessible for the Queensland Health staff working up in the Torres and Cape Health Service, Hospital and Health Service. Now, I also wanted to mention that I'm a member of the Credentialled Diabetes Educator, as well as the Torres Strait Islander Nurses Indigenous Corporation, which was established in 2012. So we're a group of nurses that come together and support each other however we can in our nursing career. And I just wanted to explain the emblem that I have up there, the vision with care. So the star in the background, the star represents the 5 island clusters of the Torres Strait. Green represents our islands and communities. The headdress, the headdress there near the bird, close to the bird, That's the dari or dari that symbolizes our world. The blue represents the water that surrounds us, and the eagle is the majestic bird which soars high and sees everything from up above. That represents the group and carries the drum that represents the messages that we carry throughout the land in which we work, or the communities in which we work. So our message of empowerment through education. So we encourage and prepare our kids for a career in nursing. We help with recruitment in the TCHHS health service, advocating for pathways into nursing, retention. We aim to keep our nurses in nursing and bring them back home, as well as supporting through studies and issues in workplaces and the progressing through the nursing structure itself. And I've just got a couple of links there for people wanting to pursue a career in diabetes education. ADA offers a scholarship there for Aboriginal Torres Strait Islander people. It's an educational scholarship program through ADA, as well as the Health InfoNet, which has some scholarships there for people throughout Australia. Yep. And I think that's it for me, everyone. Is there any questions?
Thank you, Shirley. People were wrapped in that. I've got a couple of questions in the chat. The first one is from Nola, just wondering about access to retinal photography in the Torres Strait and NPA. She particularly referenced some work from, Sharon Atkinson Briggs, some work that she did around Rubalara Aboriginal Corporation. But retinopathy, I got the word right. Retinal photography. Do you have access to those services?
Yes, we have a retinal camera here in NPA. We do, yes, and we do take pictures of our clients, and then we have an optometrist that visits. So we also send those pictures off to him, and then he discusses all that with the ophthalmologist.
Nola, did you want to follow up with anything further to that?
No, not really. Just to say that in that article, Sharon describes how useful it was to have clients look at the back of their own eyes and realize, oh, this is what that sugar is doing to my eyes. So it was a really useful tool for diabetes educators to use with patients.
Yes, absolutely. It is. I mean, we're visual people, and to actually see what's going on in their eyes and what's causing the blurred vision, they're amazed.
Also got, how you're inspiring me to finish my studies, to follow in your footsteps, to become a CDE. There's also Deborah Dowsett, you've been accepted, Deborah, but you're deferring it until you complete your Cert 4 in Aboriginal health practitioner. Is that right, Deborah?
Yeah, I'm just finishing off my diploma in primary healthcare, and then I've put my application in to do my Cert 4 at Central Queensland Uni, and then I've also put in to do my Cert 4 in Diabetes Education, which I've been accepted, but I deferred because I didn't realise I needed to do the Cert 4 in practice first.
Right.
I'm mindful that there are a number of people who are probably from interstate. I think Satenda, I can see you there, from South Australia, some people from New South Wales. I don't know if they sort of the geographical area where you work and where you're from, Shirley, is a very interesting part of the country. It's the only part of Australia that borders, 3 countries: Australia, Papua New Guinea to the northeast, north and northeast, and the West Papuan province of Indonesia to the northwest. So it's a really unique part of the country where the Melanesian people, the First Nations people, and I know that there is that thing that you said, they look at you as just a health worker, not just a health worker, but they don't recognise your cred because you're from local and that. But they also don't realise that the cultural differences in the region. Don't assume that Shirley knows about everything there because of expand a little bit more about that especially for our interstate people who checked logged in.
Yes, so where I work it's the northern tip of Queensland, Northern Peninsula Area, and so we have the larger population of both Torres Strait Islanders and Aboriginal people here. So me coming from Torres Strait to work here, I have never worked in Aboriginal communities or lived and worked in Aboriginal communities, so I had to come in and really think about who I am, where I'm from, and also then sit with the local health workers from country here and have a yarn with them about how they do things, how they engage with their mob, and always checking in on them to say, before I go out, to say, okay, I want to do this. Is this the right way of doing it? And yeah, or can I just go to someone's house and knock on the door and say, I need to talk to this person, or do I need to have one of you come with me? And yeah, but as long as I'm on the phone, I introduce myself on the phone at first to them before going out, and then explaining that who I am and where I'm from, and then if they're happy for me to come home and do a home visit, that's always helpful when dealing with the local people here. And from where I was over in Thursday Island, we also have it's a little multicultural island. People from Asia, from the Pacific Islands, as well as Papua New Guinea, and of course Aboriginal people also there, and it's different because I was raised on here. I knew how to I suppose communicate. I felt at ease communicating with these people there, and coming into a new community, I had to again sit back and learn the ropes before going out.
There's an interesting thing you said in your presentation, and it's one of the reasons why we are, putting the spotlight on people like yourselves, Shirley, and Heather before, but anyway, Aboriginal and Torres Strait Islander diabetes educators, health workers, and practitioners we feel are like the foundation. These are the ones that will move health statistics, and it's interesting that you noted that there's a lot of times non-Indigenous health professionals come in, and they come in and say, okay, now it's my way or the highway, I know how to do it. And then it takes a while for them to realise that it is the Aboriginal Islander health workforce that is crucial to it, and people like ourselves who are not Indigenous health workers and practitioners and health professionals, sometimes we've got to take a back seat and look at the experienced by people like yourself. I know Grace Ward is logged in, people like yourself, Grace, Aboriginal health workers and practitioners who are, to me, the cornerstone foundation. Tell me about that, because I know it was one little dot point you had, but it's like the undermining of health, something like that. I forgot what it is, but
Yeah, yeah. Just always being questioned, or especially when they're I suppose, because I work in primary healthcare, when I go into the hospital, there's a lot of nurses that come through, agency nurses that come through, and locums that come through that don't know me, and I walk in and to the hospital, and they think that and I ask to see a patient, and they're like, "Oh, are you a health worker?" No, I'm not a health worker. You called me. I'm the diabetes educator. Oh, okay. Sorry, we weren't expecting you. But yeah, you weren't expecting a black fellow, weren't you? So yeah. But and also then when talking to the doctors, they say, "Oh no, this is how we do it where I'm come from." No, where you come. This is not where you come from. This is a different place. This is how things work here. We need to stay focused on. You need to stay focused on where you are and do things how we do things here. Because what worked in where you're from, mainstream, whichever major hospital you're from, that's or whichever other community you're from, AMS, that works there, but not here.
thanks, Shirley. I like put people on the spot, and I noticed that there's a couple of Indigenous diabetes educators in with us now, and particularly Grace and Louise. I think Louise is there in Mount Isa. Louise, do you want to jump in and add anything from your experience? No, she's not there. What about you, Grace? Oh, Louise says, sorry, I don't have a mic. What about you, Grace? Anything?
Hey, last time we did something with Louise, when we wanted to look at her, she didn't have a camera. Something going on here. No, marvellous work you do, Shirley, and I think a worthy nominee for the Indigenous CDE of the Year. So I'm not sure if everyone knows there's a new, you know, how they have the CDE of the Year. This year they're introducing a couple more, and one of them is the Indigenous CDE of the Year. So I think that's great recognition by the ADEA to, you know, recognise that there is a different sort of cohort, as you've mentioned.
Yeah,
That's it.
it's excellent.
Well, please bear with me. I'd like to do my own thing here. I just wanted to share my screen and show something from, you know, what I'm going to bring up, don't you, Shirley? That newspaper article about making history in the Torres Strait. I just wanted to highlight that the area that geographical area where Shirley's talking about is about 80 to 90% Aboriginal and Torres Strait Islander people. It's a very high percentage. So you would expect that over the years that in the fields of, you know, employment and industry and health, and that you would see a lot of Aboriginal people, a lot of Torres Strait Islander people running the show because of the sheer number, you know, 80 to 90%. But I'll just share screen if I know how to do it and show this newspaper article. So this is, if you bear with me, a story about Indigenous nurses making history in Thursday Island Hospital General Ward in 2016, where this group here with a Shirley there on second from the left next to Fred, Shirley, May, Robin and Macaulay Max, doing a shift on Thursday Island Hospital as nurses and looking around at each other. It was a late night shift, wasn't it, Shirley?
It was a late shift, yes.
It's a late shift, and they looked around each other and realised this is the first time in the history of the Thursday Island Hospital that the 100%, all of the nursing staff were Torres Strait Islanders. So it was 2016. Would seem a momentous occasion, and would seem that's something that is built upon and really strengthened. But I don't know if it's happening now these days, Shirley, the way you mentioned that contract nurses come in and locums and that.
We bring a lot of the new grads in all Aboriginal and Torres Strait Islander new grads into the hospital. Yeah. Yeah.
But that's one of the reasons why we spotlighting people like Shirley. So there's Aboriginal Islander health workers, practitioners that are clicking in, or people that are working with Aboriginal Islander health professionals, just to encourage them to, pursue the same sort of path that Shirley's taken in her doing her postgrad in diabetes education. The same thing that Deborah, who's just clicked out, Deborah will do as soon as she finishes a health practitioner. But it's crucial to be able to do the stuff around closing the gap. We need more Aboriginal and Torres Strait Islander allied health professionals, GPs, all that sort of stuff. But I just like that photo, the fact that it took until 2016 for that to happen is a bit of a indication of the barriers that Aboriginal people are facing when they're trying to work in this field.
Eric,
anyway,
Eric,
yes,
sorry, can I just add one more thing? I just wanted to let everyone know that Louise is doing her credentialing now, and hopefully be finished that by mid-year. And Louise will be the first Aboriginal health practitioner to become, I'm hoping she will be the first, to become a credentialed diabetes educator. So I think down the track, that's one story that we're really going to have to hear. So congratulations, Louise. And I look forward to celebrating you being the first AHP with a CDE title.
Congratulations, Louise. Yeah.
Okay. I'm just looking at the comments, and Nola's leaving us, but particularly wanted to say it was a very informative, inspiring session, Shirley.
Oh, thank you.
As would most people. It's 11:52. Does anyone want to jump in with any questions, comments? Feel quite free. That's about it. I'm glad that people got a chance to click in to listen to this very informative, inspiring story. We have changed it over the years because we know that people are very time poor, and you allocated this time block in your busy Friday. So I appreciate everyone that's clicked in and made the time. Hope you got a lot out of it. I definitely do every time, but definitely with Shirley. Yes, from Marie Warren to everyone. That was awesome, Shirley. Thanks.
Thank you, everyone. Thank you for having me today. Okay.
But everyone, we'll just let people comment, and then I'll close off. So Louise doing, just all round thanks coming in the comment section.